You went to the doctor. All your tests came back normal, but you still feel exhausted. You still can't sleep properly, your muscles still cramp, your heart still races for no reason. Your anxiety never fully goes away. Magnesium not tested. Here is why. Standard blood tests almost never check magnesium levels, yet 8 out of 10 adults worldwide are deficient in it. 80% of adults are deficient. Most of them have no idea. Human body outline organs, lighting up one by one: heart, brain, muscles, kidneys, bones. Magnesium is involved in over 300 chemical reactions happening inside your body right now. Without enough of it, your entire system starts breaking down. Slowly, silently, without obvious warning. Today, I am going to show you exactly what is happening inside your body when magnesium is low, and the simple daily steps that reverse it, starting tonight. Stay till minute 11, the supplement mistake. That makes magnesium deficiency worse. You are taking calcium for your bones. You are taking vitamin D to absorb it. You are doing everything right. But here is what nobody told you. Calcium needs a traffic controller. Without it, calcium goes to the wrong
place.
Not into your bones, into your arteries. Artery calcium deposits slowly building on artery walls, glowing white, blood flow narrowing. Red danger glow builds around the vessel. This process is called arterial calcification. It is one of the leading causes of heart attack and stroke, and it is happening silently right now in millions of people who think they are doing everything correctly. The problem is not your calcium. The problem is one missing vitamin. Clean, scientific, bright K2 molecule appears labeled, glows softly. Vitamin K2. 97% of adults are severely deficient in it. Almost no standard blood test checks for it. And without it, your bones go soft while your arteries go hard. In this video, I am going to show you exactly what K2 does inside your heart, your bones, and your brain, and the simple daily steps that change everything. Stay till minute 11. The vitamin D mistake. That makes K2 completely useless. Welcome to Dr. Cato Lifestyle. Every single day we take real health science and break it down into information you can actually use. No guesswork, no confusion, just clear, honest, research-backed answers. If this is your first time here, hit subscribe right now and turn on the bell. We upload every single day. And what is coming this week, you do not want to miss. What is vitamin K2? Leafy green vegetables, labeled K1. Fermented foods, egg yolks, aged cheese, labeled K2. Before we talk about what K2 does to your body, you need to understand one critical thing. Vitamin K1 and vitamin K2 are not the same vitamin. They share a name. They do completely different jobs. Vitamin K1 found in leafy greens, spinach, kale, broccoli, goes directly to the liver. Primary job, blood clotting, stays in the liver and gets used quickly. Vitamin K2, found in fermented foods, animal fats, egg yolks, travels to soft tissues, arteries, bones, brain, kidneys. Primary job, directing where calcium goes in your body. Controls proteins that determine calcium's destination. Visual summary card side-by-side comparison. K1 equals liver, blood clotting. K2 equals arteries plus bones plus brain, calcium direction. Clean, bold, color-coded. This is why eating salad every day does not protect your arteries from calcium buildup. Spinach gives you K1. Your arteries need K2. And almost nobody is getting enough of it. A 2015 population study found that over 97% of adults in Western countries have suboptimal vitamin K2 levels. Source: British Journal of Nutrition. The calcium traffic controller. Calcium molecules, as white glowing dots, they float through bloodstream. 2 destinations shown, bones blue, correct, and arteries red, wrong. Here's the most important concept in this entire video. Calcium is not intelligent. Left on its own, it deposits wherever the conditions allow it. Into bone, into arteries, into kidneys, into joints. Vitamin K2 controls 2 critical proteins that determine where calcium actually goes. Protein 1, osteoporosis. This protein lives in your bones. When activated by K2, it grabs calcium from the blood and locks it into bone tissue. Strong bones, dense bones, fracture-resistant bones. Without K2, osteocalcin sits inactive. Calcium floats past your bones. Unused. Animation. Osteocalcin, inactive gray, gives K2 arrives. Gives activates blue glow. Gives grabs calcium, gives deposits into bone. Clear 4-step flow. Protein 2 matrix, GLA protein MGP. This protein lives in your artery walls. When activated by K2, it acts like a bouncer. It blocks calcium from depositing in the artery wall. It pushes it back into circulation, back toward the bones. Without K2, MGP is inactive. Calcium deposits freely inside your artery walls. This is arterial calcification. This is what hardens arteries. This is what causes heart attacks. Artery wall, MGP, inactive red glow. Calcium building up versus MGP, activated by K2 green glow, calcium blocked. Artery clean, side by side. Bold visual contrast. This is the mechanism. K2 does not dissolve calcium. K2 is a biological traffic controller, sending calcium to exactly where your body needs it, and keeping it out of exactly where it destroys you. K2 and your arteries. Detailed but clean. Coronary arteries shown blood flow visible. Calcium plaque slowly building on walls, pulsing red warning glow. Let us go deep on what K2 deficiency does to your heart. Arterial calcification is not just about blocked arteries. It is about something called arterial stiffness. When calcium deposits inside artery walls, the walls lose flexibility. They cannot expand and contract with each heartbeat. Your heart pumps harder to push blood through rigid pipes. Risk of heart attack and stroke increases dramatically. Healthy artery, flexible, expanding with pulse green. Calcified artery, rigid, barely moving red. Pulse waves shown traveling through both. This is not a theoretical risk. The Rotterdam study, one of the largest and longest cardiovascular studies in history, followed over 4,800 adults for 10 years. Rotterdam Study, Journal of Nutrition, 2004. People with the highest vitamin K2 intake had 57% lower risk of dying from heart disease, compared to those with the lowest intake, and 52% lower risk of severe arterial calcification, 57% lower heart disease death risk. Source visible at bottom. Amber highlight box. 57% is not a marginal improvement. That is more than half the risk from one nutrient that most people have never been told about. And critically, this benefit was found with K2 specifically, not K1. In the same study, K1 showed no significant cardiovascular benefit. Side-by-side stat card. K1 cardiovascular benefit. Minimal K2 cardiovascular benefit. 57% lower risk. Bold visual. Clear contrast. Your artery health is not about eating less fat. It is about giving your arteries the protein activator they need to stay clean. K2 in your bones, plus brain. Bone density scan, split view. High K2, dense bone structure solid blue. Low K2, porous, honeycomb-like bone, faded, fragile. Now let us talk about your bones. The mainstream advice for bone health is simple. Take calcium. Take vitamin D, and you will be fine. Here is the problem. Vitamin D increases calcium absorption from food. Significantly, more calcium enters your blood. But without K2, that calcium has no guidance system. It floats in the blood. It cannot enter the bone effectively. And it looks for somewhere else to deposit. Calcium flood entering bloodstream after vitamin D supplement. No K2 present calcium swirls. Confused, some depositing in artery wall. K2 present calcium guided directly into bone matrix. Clean flow. This is why taking calcium and vitamin D alone is not only incomplete, it may actively increase arterial calcification risk. In people who are already K2 deficient. Research Osteoporosis International, 2013. Vitamin K2 supplementation significantly reduced vertebral fracture risk by up to 60% in postmenopausal women over a 3-year period, without any additional calcium supplementation. Bone fracture risk chart, before K2 versus after K2 supplementation. Bar graph, clear visual difference. 60% reduction shown. Now the brain connection. This is the part almost nobody talks about. Brain scan animation, neurons firing. K2 molecules shown crossing blood-brain barrier, highlighted in blue. Vitamin K2 is found in significant concentrations inside brain tissue. It activates a protein called Gas6, which protects neurons from oxidative damage and supports the myelin sheath around nerve fibers. The myelin sheath is the insulation around your nerves. Without it, nerve signals slow down or misfire completely. Emerging research published in the journal Neuropharmacology in 2019 showed that K2 plays a direct protective role in preventing neurodegenerative decline. Research citation card, Research Neuropharmacology, 2019. Vitamin K2 showed neuroprotective effects in multiple preclinical models, reducing neuroinflammation and protecting against mitochondrial dysfunction in brain cells. Translation: K2 does not just protect your heart and bones. It actively protects the cells inside your brain. The 8 silent signs of K2 deficiency. Warning icon amber, pulsing gently, number countdown. 8 cards appear one by one. Here are 8 silent signs that your K2 levels may be low. Most people have 3 or more and never connect them. SIGN1. High blood pressure with no clear cause. Arterial stiffness from calcium buildup raises blood pressure. You treat the symptom, not the cause. SIGN2. Calcium deposits, kidney stones, or bone spurs. Calcium going to the wrong places. MGP is not activated. K2 is low. SIGN3. Varicose veins. K2 activates proteins that maintain vein wall integrity. Deficiency weakens vein structure over time. SIGN4. Brittle teeth, cavities, despite brushing. K2 activates osteocalcin in teeth, not just bones. Low K2 equals soft enamel equals rapid decay. SIGN5. Joint pain or calcification. Calcium depositing in cartilage instead of bone. K2 deficiency allows this misdirection. SIGN6. Memory issues or brain fog. Myelin sheath degradation begins silently. Nerve signals slow before symptoms become obvious. SIGN7. Osteoporosis or low bone density. Taking calcium and D3 but still losing bone density. K2 is almost certainly the missing link. Though K1 handles primary clotting, K2 affects supporting proteins in blood vessel walls. Deficiency can affect vessel integrity under the skin. Summary, checklist, all 8 signs listed. How many of these sound familiar? Who should be careful? Amber warning, icon.com, design not alarming. 4 cards slide in one at a time. For most healthy adults, increasing K2 through food and supplements is safe. However, there are specific situations requiring caution. People on blood thinners, especially warfarin. Warfarin works by blocking vitamin K activity. Adding K2 can interfere with this medication directly. This is a critical interaction. Consult your physician. People with a history of blood clots. K2 supports clotting pathways. If you are on anticoagulation therapy, medical guidance first. People with rare clotting disorders, hypercoagulable conditions, require careful monitoring before changing any vitamin K intake. Pregnant women, K2 is considered safe, but as with any supplement, always inform your healthcare provider. Warning cards. Bottom text. Food sources are safe for almost everyone. For everyone else not on these medications, the data on K2 is clear. The risk of not having enough is far greater than the risk of correcting the deficiency. Food sources plus the D3 mistake. Title card slams. The vitamin D mistake. Here is the mistake that makes K2 useless, and most people are making it right now. Vitamin D3 and vitamin K2 work together. D3 increases calcium absorption. K2 directs that calcium to the right place. If you take vitamin D3 without K2, that has no guidance system. It has nowhere to go except your arteries. D3 supplement enters system. Calcium absorption surges, shown as bright white flood. No K2 present. Calcium swarms artery wall. Red danger glow. K2 added, calcium immediately redirected into bone. Green, safe glow. D3 without K2 is like opening a floodgate without building the canal first. The water goes everywhere except where you need it. Bold visual equation on screen. Vitamin D3 plus K2 equals calcium into bones. Vitamin D3 alone equals calcium into arteries. NOW. The best food sources of K2. Top 8 sources with amounts. Best food sources of vitamin K2. Natto fermented soybeans minus 1000 mcg per 100 grams. Hard-aged cheese, Gouda, Edam, 75 mcg per 100 grams. Egg yolks minus 32 mcg per 100 grams. Chicken liver, 14 mcg per 100 grams. Butter grass-fed 15 mcg per 100 grams. Dark chicken meat, 9 mcg per 100 grams. Beef liver, minus 11 mcg per 100 grams. Sauerkraut fermented 5 mcg per 100 grams. Number 1 source in the world. Natto is the single most powerful food source. One serving provides far more K2 than any other food. If natto is not available in your area, aged Gouda or Edam cheese plus egg yolks daily is a practical and effective alternative. For supplementation, the most important detail, supplement comparison card. MK27 form. Long half-life, 72-hour activity in body. Best choice MK4 form, short half-life. Needs multiple daily doses. Standard dose, 100 to 200 mcg of MK7 per day. Always take with your largest meal. K2 is fat-soluble, and always take it alongside your vitamin D3. They are designed to work together. Your action plan, start this week. Step 1. Add egg yolks and aged cheese to your daily diet. Do not remove the yolk. K2 is entirely in the yolk. Step 2. If you are taking vitamin D3, Add MK7 form of K2 immediately. 100 to 200 mcg per day with your largest meal. Step 3. Stop taking calcium supplements alone. If you need calcium, always pair it with K2 and D3, all three together, not any one alone. Step 4. If you have high blood pressure, bone loss, or kidney stones, ask your doctor specifically to evaluate your K2 status. Most will not think to check it on their own. Step 5. Give it 60 days minimum. That has been misplaced over years. This is not a one-week fix. This is a long-term investment in your arteries and your life. 5-step checklist animation. Each green tick appears with soft sound. Final card shows 1 vitamin, 2 proteins activated, heart, bones, and brain, all protected. Subscribe right now and hit the bell icon. Tomorrow, I reveal the exact daily protocol, combining K2, D3, and magnesium, in the right doses and right timing, for maximum artery protection. Most people get the combination completely wrong. Subscribe right now and hit the bell icon, so you do not miss tomorrow. If this video opened your eyes to something your doctor never mentioned, please like it right now, and share it with someone who is taking vitamin D. Without K2, they need to see this today. Like button. Watch tomorrow gives